Okay, this is the seating positioning evaluation. As you can see here, we've got a right-handed side and then a left-handed side, okay? On the left side of the column here, there is sextant, so that's the area that you're going to be working on, okay? And then your seating position, the position that you will be seated in, and then the patient position, how the patient should be positioned, okay? So this is going to be true for dental hygiene in general, right? So the correct positioning that you want to be in. As you get out into practice, you might feel more comfortable with indirect vision and can sit in different spots. But for now, this is what's going to be best for you ergonomically, and that way you can see things directly or have better access to areas of the mouth, okay? So for the checkoff, I want you to be able to say the area that you are working on, the position, and whether you want chin up, patient slightly turned away or towards, what position for you and your patient. So we as instructors are going to prompt you. We're not necessarily going to go in this exact order, but we're going to prompt you what area of the mouth, and you're going to have to sit in the right position, tell us the position you're in, and then how your patient's going to be. So for example, I will say maxillary right buccal. You'll need to get into the right position. So I'll say 8 or 9 o'clock. The patient's chin is going to be up and slightly turned away, okay? And that's for the maxillary right buccal here, okay? And again, when we're thinking about surfaces towards and away, remember, if you're right-handed clinician or left-handed clinician, it's going to be any surface that is closest to you on that given tooth or on that given area of the mouth, okay? All right, and then next we have maxillary anterior labial surfaces towards. So again, all the surfaces on the anterior that are closest to you, so that right-hand side. I'm again going to be in this 8 or 9 o'clock position, or you can also be in the 12 o'clock position. How the patient is going to be, remember maxillary, they're going to be chin up, and they're going to be neutral. Their head's going to be neutral. It's not going to be left or right. So I could be at the 8 or 9 position, or I could be at the 12 to get these towards surfaces, okay? All right, and then we've got the maxillary left buccal. Sorry, I skipped one. Maxillary anterior labial surfaces away. So again, we're going to be at 12 o'clock for these away surfaces on the maxillary anterior, okay? The patient again is going to be chin up and neutral. So that was just that third box there. We just went over that third box, okay? Maxillary left buccal, we're going to be in that 10 to 12 position. Okay, so the maxillary left buccal is all the surfaces on the buccal side of the patient on the maxillary. Okay, so I'm going to be in that 10 to 12 o'clock position. So in between 9 and 12, right? 10 to 12. Okay, the patient's going to be chin up and towards the operator. That way I can see these surfaces a little bit better. So chin up and towards me slightly like that. Okay. Then we have maxillary right lingual. Okay. So those are the surfaces on the maxillary, right side, on the lingual or palatal side. I'm again going to be at this 10 to 12 o'clock position. The patient's going to be chin up and towards the operator. So same positioning as the maxillary left buccal. Okay. Maxillary anterior lingual surfaces away. So we're back up to the maxillary anterior. On that lingual side, so we'll be using that indirect vision, right? Okay. We'll be at 12 o'clock. Patient has their chin up and neutral. Okay, we'll be in the same position for the maxillary anterior lingual and for the surfaces away and towards. So away and towards will be in this position here. Okay, and that's for those lingual surfaces. Maxillary left lingual. Okay, so you kind of have to picture and point out the area of the mouth. So as you're practicing on each other, you'll want to have an instrument like an Explorer and kind of be able to point to, okay, this is the area I'm working on. What position will I want to be in? Okay. Okay, maxillary left lingual, we're going to be at 8 o'clock. The chin is going to be up and neutral. Okay. Maxillary left lingual. Sometimes they can kind of be up and away so that you can see it a little bit more directly, but our sheet says neutral, so we'll go with that. Okay. Mandibular right buccal, so that's on the bottom, mandibular right buccal. We're going to be again at 8 o'clock here, chin down, because we're working on mandibular and neutral. Mandibular anterior labial surfaces towards. We'll be at 8 o'clock, chin down, neutral. So those are all of the facial surfaces on the mandible that are closest to you. You'll be at this 8 o'clock position. Okay. Mandibular anterior labial surfaces away. Okay, so those facial surfaces on the side that is away from you, you're going to be at 12 o'clock. Okay, that way you can access those areas better. Okay. Mandibular left buccal. Okay, so that's left-hand side. We are going to be in 10 to 12 o'clock. The patient's chin is going to be down and towards the operator. Okay, so that's this lower area here. Okay. Mandibular right lingual. So mandibular right lingual, remember that's towards the tongue side. We're going to be again in that 10 to 12 position, chin down, patient is towards the operator. So chin's going to be down and the patient is looking towards me. That way I can look directly into that lingual surface area. Okay. All right, and then mandibular anterior lingual surfaces towards are at 8 o'clock. Okay, so the surfaces towards in the mandibular, we're going to be sitting at that 8 o'clock. This is the lingual, so we'll be using our indirect vision, okay? And those are the surfaces that are closest to me on the lingual and the mandibular, okay? So the patient's chin is going to be down, neutral, and we'll use indirect vision. Mandibular anterior lingual surfaces away, so the lingual surface away, we are going to be at 12 o'clock, and we'll also use indirect vision for that as well. On the lingual surface, okay? All right. And then the mandibular left lingual, we're going to be at 8 o'clock for that. That's that very last box there. Mandibular left lingual, so that's this opposite side from me, but it is a toward surface, okay? That is going to be chin down, patient slightly turned away so I can see things directly, okay? Now we have the left-handed seating position. Okay, so as you're reviewing this and you understand that there's different times, if you are a lefty, we will go by this left-handed sheet. If you're a righty, we'll go by the right-handed sheet. So really a lot of this is going to take memorization on your own, remembering the positions. However, it's going to be great to practice in person so you can visualize the area of the mouth and that you're in the correct position and that your patient's in the right position, and then you'll be able to see that, yes, I can see that directly, or that puts me in the right position, okay? So it might be a little bit confusing me just sitting here and telling you those areas. It'll make more sense when you're in clinic. And we can sit down and we're gonna sit down and show you these as well, but I think it's good to have this referenced on the video. So most of your sheets will look like this. So you'll be responsible for stating the position and being in the right position. So you say if you're at 12 o'clock, you're sitting in 12 o'clock and you have the patient's head positioned the right way and you're gonna say that, okay? So for example, if I'm an instructor and it's checkoff day and I'm saying, okay, maxillary left lingual, I need to know that for a left-handed clinician, you're gonna be in that 1 to 2 o'clock position. The patient's chin is gonna be up and towards the operator. So I want you to get in the right position, tell me where you are, get the patient in the right position, and tell me what that is, okay? All right, thank you.